My name is Sue Williams. I've been riding motorcycles for over 50 years. I had my first bike when I was 15, and so I just never stopped riding. I tore my first cruciate when I was 21. After my knee problems, when I would ride, it was hard for me, if I had a bigger bike, to plant my foot just because of the knee on either side. When you're riding, it's not that big of a deal except for the jolts you get from the surface of the road. Having knee problems kind of exacerbates that, and you don't want to ride because it hurts. And as I get older, it was difficult for me to even want to ride. I wanted to ride, but I couldn't because I knew I would be down for like a day or so, just with icing my knees and all that stuff. I just started working more because all I did was teach motorcycle safety. That's all I did. And so I was constantly on it and never really gave it a rest. I had difficulty walking upstairs. Nobody knows what knee joint pain feels like until you have it. And once you have it, it's like bone against bone. And if you can just imagine crushing against this, that's what it felt like. And nobody wants to put up with that. And then I needed to see somebody because my knee would swell. My PA referred me to Dr. Goldberg. And so I went there and he took some fluid off and he injected it. I wasn't sure that he was going to be my friend then, but after a while, it felt great. I always went back to him and I saw him every probably 3 or 4 months for another injection. He goes, all right, when it hurts bad enough, you're going to come back and see me. And eventually I did. He's not like your regular doctor. He walked in and it's smiling, he's shaking your hands, he's talking to you like he's your friend and he wants to get to know you. Because it wasn't like, let's go in, let's cut this open and do this and let's go. It was like, let's work with it, see what we can do with it. And then when we get to that point, we'll both know. And then he fixed it, and that was a marvel in itself. It's been like a godsend because there are things I can do now that I thought I'd never do again, actually. I wasn't sure I'd actually be able to ride again. I live almost an hour and 10 minutes away from his office now, and I would drive anywhere. I would drive, if he was in San Antonio, I would drive to see him. Anybody that is considering orthopedic surgery, I will tell you, you will not waste your time traveling from wherever you are to do a consultation with Dr. Goldberg. It's not like you're going to come in and he's going to say, okay, let's cut you open. That's not what it's about. That's not what he's about. He's about making sure of what's going on with your knee before even doing anything. So if you're considering, I don't care where you are, I don't care where you live, because it would be worth flying to wherever he is and having a consultation. I love this man, and I know it sounds kind of odd to say that, but you don't know what it's like to have somebody give you back freedom. Freedom to ride, freedom to walk, freedom to hang out with your friends. He is an exceptional guy. My quality of life after having Dr. Goldberg do my knees, because he's done both of them now, I can do whatever I want. I can walk my dog. I can ride wherever I want to ride. I can walk with friends. I can go out with friends again. If you need a knee replacement, if you need knee anything, if you have problems with your knee, if you have joint discomfort in your knee, go see Dr. Goldberg, because he would treat you like a good friend and he would give you good sound advice.